Welcome to Coruzant Technologies, home of the Digital Executive Podcast.
Welcome to the Digital Executive. Today's guest is Hari Prasad. Hari Prasad is pioneering the modernization of the entire healthcare patient experience. He is co-founder and CEO of Yosi Health, a full-service technology ecosystem that connects patients with their providers through the entire care journey before, during, and after the visit, creating delightful patient experiences. Well, good afternoon, Hari. Welcome to the show.
Good to be with you, Brian.
Amazing. Thank you again for joining. We've been working on getting this podcast scheduled, and now we're here. Today's the day, and we're good to share your story with our global audience. So thanks again, Hari. So Hari, jumping right into the questions here, you've got quite the career in technology, healthcare, finance, and now the co-founder and CEO of Yosi Health. Could you share with our audience the secret to your career growth and what inspires you?
Sure, Brian. So very early on, I decided to end up attending graduate program instead of accepting my job offers. So in hindsight, looking back, that was very instrumental to my career growth. And I've always, as a person, enjoyed learning and have a strong belief about, things that could be done better. So questioning that status quo has consistently, once again, helped me with the career growth and my success. And most importantly, I've been fortunate to have been supported well by my managers, my peers, family, and friends. So that goes a long way as well. And in fact, my first manager is one of our early backers at Yosi Health after a number of years that we've been collaborating. And as far as what inspired us to start Yosi Health, prior to Yosi, I led a number of innovative initiatives for leading organizations, healthcare organizations like United Healthcare and Montefiore Medical Center. But it was really a personal experience that motivated me to focus on the provider front offices. So I had a shoulder dislocation, was taken to the ER, and with a painfully dislocated shoulder, had to sit there and fill out a bunch of forms pre-admission. So I came back and I wanted to see what physicians think of their front office experiences. And I interviewed hundreds of them, and most of them consistently wanted less paperwork and more personalized interaction with their patients, in addition to obtaining vital information from their patients. So when I looked at the market, the existing solutions were either disappointing or were non-existent in terms of creating that experience. So that personal experience is what allowed us to then focus on creating Yosi Health.
That's awesome. And it's interesting how ideas come out of situations, out of a lot of times, a challenging or difficult experience. So I appreciate the story on that. Thank you so much, Hari. So let's talk about the pandemic a little bit. It's starting to lift. We've all had to make these shifts and adjustments and sacrifices during the lockdown, right? But what are your plans for growth going forward? And will it be any different than during the lockdown?
Yeah, sure, Brian. So for the audience listening, at Yosi Health, we provide a software platform that allows for the patient intake management to be done virtually. So the pandemic has highlighted the need for our platform and has created a strong demand for it because we help manage those visits virtually. So like everyone else during the pandemic, we had to quickly adapt to doing everything virtually. Overnight, we had to change all of our plans and strategies. In fact, our team back in March 2020, we were planning to attend a number of conferences in March and April, and a lot of those were canceled, so we didn't have to attend those conferences. So quickly, we had to pivot and start managing things remotely. Our sales team, our deployment team became pretty adept in running our business virtually. So we do expect that to continue post-pandemic once this lifts. So we are looking forward to continuing to do what has been successful for us during the pandemic. And we also created a number of partnerships in order to grow our business. So we're planning to double down on those channels that we created during the pandemic and also focus on some of the new channels and opportunities that has come to us as a result of the pandemic. So now we're partnering with other companies in the space that we work in. So we're excited about some of those opportunities that the pandemic has created.
Thank you for sharing that, Hari. And you're right. While a lot of businesses were devastated during the pandemic, we have found that most entrepreneurs, most businesses were very resilient and took on the challenge and found ways to navigate through this and actually come ahead. So thank you again for sharing. And Hari, this is a big one for us, our technology platform. You're obviously leveraging some new and emerging technologies within your tech stack, right? Is there anything you might be able to share with us today?
Sure. So our team has been working on some really exciting things now. And one of our key priorities at Yosi Health is to help improve patient outcomes, Brian. So working on some really exciting data science initiatives to help come up with some predictive analytics and information to help the physicians understand the patient's health well before the visit begins. Our goal is to empower the physicians to help improve patient outcomes. So a lot of the work that we're doing revolves around data science and allowing the physicians to really see a full picture of the patient's health. And we believe this has a tremendous impact on coordinating the care for the patients, making sure that they're taking all their medications on time at the right time, and avoiding any hospital admissions. So one specific example I can provide you is our efforts in helping identify patients that are at high risk for opioid abuse. The pandemic has shown a lot of light on the worsening opioid crisis, and it's gotten much worse during the pandemic with everything now being shut down. So one of the key initiatives that we started working on during the pandemic is how do we now help physicians identify patients that may be at high risk for opioid abuse. And by identifying those high-risk patients, we're now empowering the physicians to intervene at the right time with low-tech ideas that might mitigate the risk for those patients that might end up abusing opioids. And we're tremendously pleased to see some of those initial results. And we're looking to now continuing to expand on how do we now make this widely available to more clinicians? So that's one specific example. And we're also continuously teaching our systems to learn and automate the highly complex workflows that we get involved with clinics and physician offices. So that's an exciting internal initiative that we have that we're looking forward to seeing the results and how that might help us perform our role in deploying our software better. So a lot of exciting things from the data science initiative. And we'll also be announcing some key partnerships soon that will truly help highlight the power of our platform and to help patient outcomes be improved.
Thank you again, Ari. And my background is in healthcare technology. And so this really inspires me, makes me excited that you're actually putting some solutions back into the hands of the clinicians. And that's really, really exciting. So Hari, can you share something from your career experience that would be helpful for those looking to grow their career in healthcare or entrepreneurship?
Yes. So in terms of, the healthcare as an industry itself, unlike any other industry, everything that we do here has a direct or an indirect impact on a patient's health and their lives. So it's always very important to remember that. And if we focus on that and do everything to help or do things better, that goes a long way towards, potentially impacting someone's lives. So what I would suggest and what has worked really well for us is to find something that you're really passionate about and that excites you. And one of the things I always get inspired is by watching athletes perform at the top level. And they're constantly, working on honing their skills. They're always training. They're pushing their limits all the time. So if we build that type of mentality into what we do in our own roles, whether it's within healthcare or any other industry, if those athletes can perform at that level and consistently look to do better, imagine what we could be doing if we brought that type of, rigor and training and skills into our trade. It could be running a startup. It could be your role within a larger organization. It could be a not-for-profit work that you do. Regardless of that, if you bring in that type of passion into your work, that will propel you towards excellence, and that ends up creating a lot of impact, and hopefully will improve patient lives. So that's one thing that we have always been fortunate to have in terms of the drive for that excellence propelling us. So if you can't find that passion, not everyone needs to have that, and that's okay too. If you have the desire to, let's say, this is what my role is and I'm going to do it really well, that can still carry you forward tremendously. So I would suggest, just be open, stay hungry, meet more people. And when you meet people, you tend to be inspired by them, their stories and what they do and how they are creating impact. Join groups on LinkedIn. As you pointed out, the pandemic has allowed us to now meet more people virtually without having to travel. So take advantage of all of those things. And if you do that, you'll end up creating your own impact.
I love that. And again, Hari, you highlight some really key things around the pandemic and how you've navigated and the rest of us have navigated. And really, I think this opens up new opportunities. So Hari, I want to just personally thank you. It's a pleasure having you on the show today. And I look forward to speaking with you real soon.
Likewise, Brian. Great catching up today.
Bye for now.